basically, in females, yes, as you rightly said, like if we divide cancers, you will be surprised to know that around, say, 1,300 patients, 1,300 to 1,400 patients, they die every day of malignancy. And if we calculate it cumulative, this comes to around, say, 5 lakh per year. So maybe you can just imagine. I mean, like now we are in a pandemic situation where the coronavirus actually has really shattered the lives of many. But this particular problem, cancer or maybe roadside accidents, yeah, I mean, like 600 to 800 deaths they happen in roadside accidents or road accidents, maybe you can say. And around, say, 1,500 patients they die every day because of the cancer. So you can just understand how big is the burden of cancer and how serious is this issue. And looking at and coming to the point, I mean, like in females, the list toppers actually you can say are breast malignancy, cervical malignancy, that is a cancer of uterus, and then maybe you can say ovarian malignancy. So these three malignancies are very common in females. And to top to that, breast cancer definitely actually is increasing day by day. And if you compare rural population versus urban population, now the thing is, one female in every 22 females. If suppose like you are randomly selecting a sample, one female in every 22 female, she is actually diagnosed to have breast malignancy. This is what actually is a burden right now in urban population. And in rural population, it is 1 in 30 to 38 females. So in urban rural population, the percentage actually is slightly on the lower side as compared to the urban population. And as we know, the causes, if suppose you ask me why actually in urban females, the percentage
was just going to, yeah.
And this everybody knows because of our lifestyles. I mean, like everybody is busy now. No, now actually it's all like work from home actually is becoming this thing.
Right, it's a trend now.
It is a trend now, but everybody in IT fields, I mean, like the male population and female population are so busy, they do not have time. I mean, like for themselves, for their kids, and because of that, the urbanization actually has increased the incidence of cancer. We can say urbanization, then addiction. I mean, like you'll be surprised to know that now the tobacco consumption is more in females as well. I mean, like consumption of tobacco, consumption of alcohol is day by day increasing, and there are many reasons for that. And because of that, maybe urbanization, more socializing, then more addiction in females in urban population, the incidence of cancer is also going high. And this is why actually breast cancer incidence is high in urban population. So this is the reason basic. The thing that happens is, I mean, like if the patient has been diagnosed with cancer, or if the patient actually comes to us with the relatives, what happens is the patient is sitting outside OPD and the relative walks in. And the relative would tell us that the patient doesn't know about the diagnosis. So we would request you that do not disclose anything in front of the patient. Correct. So yeah, my point is, I mean, like patients, they are adults. I mean, like they have a right to know about themselves. I mean, like what is happening to them, what is the diagnosis, what is the outcome of it. So my request to all the viewers is, I mean, like they should not hide this thing from the patients. I mean, like they should discuss everything with the patient, but only thing is, I mean, like they should counsel them properly.
Right. Perfect.
Yeah, this is your diagnosis, but yeah, you are going to be all right. These are the outcomes, these are the ways out. And if suppose you take the treatment properly, then probably actually you will come out of it. But hiding cause or hiding cancer diagnosis from patient is not going to solve the problem.